what to expect in the planning and treatment of prostate cancer. In this video, we are going to talk about what to expect when you get a planning scan and radiation treatment for prostate cancer. Planning scan. A planning scan takes pictures and measurements of your body that your doctor will use to plan your radiation treatment. For your planning scan, you will check in at the front desk. A team member will bring you to the restroom and ask you to empty both your bladder and rectum, meaning that you should urinate or have a bowel movement if you feel you need to. Then, they will take you to a consult room where you will meet with your provider. They will review your treatment plan with you. After all of your questions have been answered, you will be asked to sign a consent for the radiation treatment. You will be given a bottle of water to drink while you wait for your planning scan. This helps to ensure that you will have a comfortably full bladder for your treatment. You should not be so full that you are in pain. If you struggle with incontinence, please let your provider know. In certain circumstances, you may need internal markers placed for treatment guidance. These markers are tiny implants that help your doctor target your tumor with radiation. If you need markers, they will be placed before your planning scan. Your treatment team will give you more information. A team member will bring you to the scanner and give you a gown and a bag. You will change out of your clothes, leaving only your socks and shoes on, and place your clothes in the bag. Please bring this bag to each radiation treatment appointment. Your position for prostate radiation treatment will depend on your individual plan. Sometimes, patients may need to be scanned and treated with their arms raised or with a device that helps you not to move. Your provider will select the best position for your treatment. You will need to arrive for each day of radiation treatment with a full bladder and empty rectum. As long as you are not constipated, nothing else is needed. If you feel constipated, talk to your provider about taking an over-the-counter stool softener or laxative. Radiation treatment. When you arrive for each radiation treatment, you will check in at our clinic front desk. Please remember to bring your photo ID each day for check-in. You will also be asked to state your name and date of birth at each appointment. Depending on your specific treatment plan, a radiation therapist may take you back to a dressing room where you may be asked to change into a gown. Your radiation therapist will then show you to the treatment machine. Your team of therapists will position you in the same way that you were scanned for your radiation planning scan. Please tell the radiation therapist if you are in pain while in position for your radiation treatment. Your team of radiation therapists will step out of the room before your treatment begins. Treatment typically lasts from 15 minutes to an hour. While treatment is being given, you will not feel or see the radiation itself. You may notice side effects of radiation develop over the course of your treatments. Because side effects may vary depending on site, treatment, or patient, please talk with your provider or care team about any side effects you have. After each treatment is finished, your therapist will assist you back to the dressing room or lobby. Treatment check. Once a week, you will be seen in clinic by your doctor after your radiation treatment. This is usually on the same day each week. This will not show up as an appointment in my chart. We will take your temperature, blood pressure, pulse, and breathing rate and bring you to a room. A nurse will review education about your treatment and side effects you may have from the radiation. Your provider will also see you at this time. Please write down any questions you have about your treatments and make sure to ask them to your care team at these appointments. We look forward to participating in your care.